you or anyone in your home sustained fall and now have difficulty in walking, don't neglect it. It could be a fractured neck of femur or trochanteric fracture. Namaskar, I am Dr. Prasun Sanyal, consultant arthroplasty surgeon. Today, I am going to discuss about two most common hip fractures which mostly occurs in the elderly patients, the neck of femur fracture and the trochanteric fracture. Now, before going to the fractures, I will discuss who are the patients who are at most risk for these fractures. The elderly patients with osteoporosis, where the bone density is significantly diminished, they are most prone for trochanteric or neck femur fractures. This is also augmented by the fact that these patients have poor balance, coordination and poor eyesight, which also increases their risk of fall and sustain this sort of fractures. These two types of fractures are usually distinguished or classified according to their anatomical locations. The neck femur fractures occurs at the neck of the femur, which is the part of the thigh bone just beneath the head of the femur or the ball of the femur, while the trochanter is the part of the femur distal to the neck in the proximal part of the thigh bone. So, what are the signs and symptoms of a neck femur fracture? Usually, the patient has a history of fall, even a low energy fall, or fall at the bathroom, or fall at the stairs, with the impact near the hip joint. Immediately after the fall, the patient cannot move his limbs, he cannot get up at his own, he cannot move his legs. There will be swelling in around the hip joint, and on careful inspection, the affected limb will be shorter than the normal one, and the attitude of the limb, the foot will be more sideways rotated than the normal limb. All these signs and symptoms are indicative of either neck femur fracture or trochanteric fracture. So what to do when you encounter such issues? Don't neglect it for any moment. Immediately seek the medical attention of a trained orthopedic surgeon or arthroplasty surgeon. Initially, they will get a X-ray done of your pelvis or hip bone, and along with that, a full-length X-ray of the affected hip joint with also needs to be done, especially in the patients who already have a total knee replacement or any other surgeries around the knee joint or hip joint in place. On rare cases, a patient with a neck femur fracture or minimally displaced or undisplaced trochanteric fractures, they may not show all of these signs. They may still be able to walk with pain and there will not be no shortening. In these patients, to detect such fractures, an MRI scan may be required. The fractures of the neck femur or the trochanter, they require immediate medical attention. Delaying the treatment can have devastating complications and consequences. So, in the next video, I am going to give a detailed description of the management of these fractures in a very simple fashion in which most of the patients can understand. Stay tuned.